most of the patients we see in our daily practice, they have a persistent fatigue and weakness. Sometimes they have bleedings. And well, quite often we see patients with infections with or without fever. Sometimes also in relationship with shortness of breath and dizziness. And well, sometimes it's also a combination of fatigue, bruising, infection, and of course, one of the um, uh, most important signs, they should be tested.
I agree. There are two presentations, really, aren't there? I think there is a more indolent presentation, and Erik has summarized that very nicely with fatigue, perhaps with repeated infection and bleeding, um, more often than bruising. Such patients can often be managed relatively uh, conservatively in the first few days. This is becoming an increasingly important management strategy. Whilst you establish the molecular basis of their disease, get the results of cytogenetics and some molecular screening, because we have increasing numbers of targeted therapies. And for these patients with a more indolent presentation, it's sometimes wise even to manage them as an outpatient for sometimes even up to a week, because that may allow you to tailor the choice of treatment. And I think the other form of presentation, which we have to be aware of, it's rarer, is that patients with acute myeloid leukemia can present acutely unwell. I'm thinking particularly of acute promyelocytic leukemia that is widely underdiagnosed, which often has a very prominent bleeding, hemorrhagic diathesis. And it's really important in such patients who often have pancytopenia that clotting studies are urgently performed, and these patients should be started on ATRA on a suspicion of APML. But there are also patients with acute myeloid leukemia who can present with severe infections. Sometimes they can have a renal impairment consequent upon a urate nephropathy, and so rehydration is important. So there is also an important population of patients where they need prompt admitting to hospital, and they really need resuscitation and institution of life-saving therapies to treat infection or bleeding diathesis.